This is Wendy Reyes, and I will be sharing to you some play therapy sample techniques. And yeah, there are a lot of examples that we can cite about how play therapy is being used in helping children to express their thoughts, to express their feelings. But we'll be only showing to you three examples that are already existing. So stay tuned and hope we're going to learn something today. Okay, for the first technique, it's called Color Your Life. Color Your Life provides children with a non-threatening, concrete method of understanding and discussing their feelings. Now, it is useful to help children verbally express their thoughts and their feelings in an appropriate manner. So, ano ba yung mga kailangan in doing this activity? Well, the materials needed would just be any coloring instrument. It could be crayons, colored pencils, paint, or chalk, and a white paper. You may begin by asking the child what feeling might go with the color red. No, if ang bata is hindi niya alam, I don't know, teacher, ano ba ang meaning ng red na color? So maybe you can help out. Think of a time when people scrunch up their faces and get very red. Then the child might associate red to getting mad. No? So yung technique na to is just helping the child to verbally interplay with color, feeling pair. So examples would be yung color feeling pair would be red for angry, purple to represent rage, blue to show being sad, black to show that you're very, very sad, or green to feeling jealous, brown to being bored, gray to being lonesome, yellow to feeling happy, and orange to being excited. Now, when the color feeling pairs are established, the child is provided with a blank paper and will be told to fill the paper with the colors to show the feelings that they have had throughout their lives. Let us remember, no, mga teachers, that itong mga play therapy techniques are being used to help a child express his or her feelings. Maybe for us adults, we are able to express our feelings verbally. No, we can use words to express our thoughts, no, how we feel. However, for children, not all of them are able to verbally tell us how they feel, tell us how they how are they what are their feelings on that moment, or what are their experiences. So by helping them in this technique, you are able to provide a child a representation of their feelings by using colors. So once the child clearly understands the task, the therapist limits his or her talking and encourages the child's discussion of the picture. The focus of the discussion might be on various life events or on the relative quantity of the assorted colors. Now, if the technique is used with a group, the children will often naturally compare drawings and a lively conversation will occur. No, kasi minsan ang mga bata, they just don't know how to express their thoughts. So one way of helping them is by using this Color Your Life technique. Example of this would be like this one. You know, this child has an anxiety issues. no, and anger management issues. And when asked how she feels, and this is how she had showed it through colors. Okay, now the next one that we're gonna talk about is itong balloons of anger activity. Now, for the balloons of anger activity, it is crucial to help children understand what anger is and how to release it appropriately. Kasi, di ba, we have encountered, I'm sure, teachers, parents, no, one way or another, we have encountered children who will suddenly explode, no, bigla na lang magagalit, magtuthrow ng mga bagay, mananakit, no, and some of these kids might have some anger management issues. So this activity is good in helping the child release tensions, release anger, or mga aggressive na feelings or emotions in a more appropriate way. So what do we need? We just need balloons, no, and then first thing that how it's done first is that the child blows up a balloon, and then the therapist helps tie it. Second, the therapist explains that the balloon represents the body, and that the air inside the balloon represents anger. The therapist asks the child, can air get in or out of the balloon? What would happen if this anger or air was stuck inside of you? Would there be room to think clearly? Then the therapist tells the child to stomp on the balloon until it explodes and all of the anger or air comes out. Next, the therapist explains that if the balloon were a person, the explosion of the balloon would be like an aggressive act. Example, hitting a person or object. Ito na yung manakit siya ng iba, no, or throwing things. Then the therapist asks the child, if this seems like a safe way to release, is this a safe way to release anger? So definitely it's not. No, and then the next one. Now this is where the teaching part continues. No, next the child blows up another balloon, but instead of tying it, the child pinches the end closed. The therapist tells the child to slowly release some of the air and then pinch it closed again. The child will love the noise that the air makes as it slowly seeps out. The therapist asks the child, is the balloon smaller? Did the balloon explode? Did the balloon and the people around stay safe when the anger was released? Does this seem like a safer way to let the anger out? At the end of the activity, the therapist again explains that the balloon represents anger. By talking about what makes us angry and by finding ways to release the anger appropriately, the anger comes out slowly and safely. The therapist then discusses various anger management technique. No, so you might want to help the child to do the counting technique, no, like 1 to 10. This is what I do personally do, no, sa mga estudyante ko, like when I'm trying to calm them down, no, when they're angry or they're having a difficulty managing their emotions, I just stand there and then let them count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then breathe in, breathe out. No, I mean you can incorporate these calming activities to help the child calm down. But this one, itong balloons of anger, is a good representation of what would happen if the child won't be able to manage his or her anger. Kaya yung iba, they resort into hurting others and destroying things. So to help them release their anger appropriately, then this balloon would be a good activity for them to understand more that they need to release their anger. It's okay to be angry, but it's not okay to hurt others, and it's not okay to throw things and destroy things, or even to hurt themselves. So we have to help the child remember also that all feelings are okay, but we need how to manage these feelings in yung purpose ng activity na to. Okay? And then the last one is ito, yung bubble breaths. Okay, bubble breaths is an extremely, or itong tawag din dito is relaxation training, or bubble breaths. Bubble breaths is an extremely useful and concrete relaxation technique designed to teach children deep and controlled breathing while helping them become aware of their own mind-body connections. So bubble blowing, we all know, is fun, inexpensive, and allows non-threatening interactions between the child and the therapist. So what do we need for this activity? Just bubbles. The therapist begins by filling the room with bubbles, and most children, as we know, will immediately begin to pop them as they fall. Now, after a few minutes, the children are asked to blow only one big bubble. The therapist teaches the children to take deep breaths from the stomach and slowly exhale. So, itong breathing technique actually ang tinuturo dito. Pero because we are using play as an instrument, play as a method in teaching children in managing their emotions, So this one is a very good activity in helping them on how to do proper breathing. Now, the therapist explains to the children that when they become angry or anxious, the brain wants more air, but the lungs are working too hard, being upset to provide it. However, if they breathe deeply, ito na yung scientific na reason why we are teaching our kids to do these breathing techniques. If they breathe deeply, their brain will tell their heart to slow and the lungs will work together. The therapist then tells the children that if they take bubble breaths, when they start to become angry, nervous, or tense, they can often prevent angry behaviors from happening. So ito naman is more on preventive na way para matulungan natin yung bata in controlling their mga big emotions na tinatawag natin. Okay, so ito tatlo lang yung nabigay natin ng mga samples, but there are a lot of other activities that are proven and tested na very useful for children in managing their behaviors. Anyway, these play therapy techniques are useful for kids ages 2 to 12 years old. So yeah, and these are the references. Okay, I hope we have learned something new today, and may God bless us all.